Welcome to a new Radiology Bits video. Today's case is an advanced musculoskeletal case. As we're used to, when you see this sign, please pause to take your time in thinking about the images. This is an adult male patient. The history is withheld. Pause here. Findings. There is a clear lesion that is located in the proximal aspect of the right thigh. The lesion is well defined and well encapsulated, showing high signal intensity on the T1 acquisition. Now, when you see T1 high signal intensity, you should think about several possibilities, and the two big compositions that could give you a high signal on T1 would be blood and fat. Since the image is also heterogeneously hyperintense on the STIR acquisition, this denotes that this lesion is not fat and indeed represents hemorrhage. On the axial image of the same patient, you'll notice that the collection is contained between the subcutaneous tissue and the fascia overlying the thigh. Now, if I tell you that this patient was involved in trauma a few months ago, combining the imaging appearance with such information would make you reach a specific diagnosis of an entity called Morel-Lavallée lesion. This is a specific lesion that results from a severe shearing injury that leads to degloving and separation of the fascia from the overlying subcutaneous tissue. When this happens, the capillaries in between disrupt, and oozing of blood, serous fluid, or a mix of both accumulates in this classic location. The importance of knowing this abnormality is that if it's not diagnosed early, it might be complicated with infection or overlying extensive skin necrosis. In addition, the accumulation of fluid might occur over a very long period of time, and this would lead to an encapsulated abnormality that might be mistaken for tumor and that may become more difficult to treat. Note, if you have an encapsulated Morel-Lavallée lesion, this cannot be treated with aspiration in most cases, and the treatment when the accumulation is chronic is typically performed by surgical excision, because if that is not done, the recurrence rate is high. The take-home point from this case is, first, a very basic rule of remembering that high signal intensity on T1 could represent a few specific things. The two most important things to remember is that fat and blood may be of high signal on such an acquisition. When you see that, looking at the fat-saturated images may help differentiating both. The second point to remember is to keep Morel-Lavallée as one of your classic ant minis. Thanks for watching. Please support us by sharing our clips, subscribing, liking our videos, or joining us on Twitter or Snapchat. See you later.